Okay, so now how to deal with patient complaints. Come here, Bridget. Bridget, come here. Bridget does not feel very good. She's not proud of herself right now because her boss just took a call from the daughter of an elderly patient who was really upset about how Bridget had taken care of her mother. And the patient had been seen by her office for a long time, and basically, she had a lot of complaints about how Bridget treated her mother. So I want to give you a little advice as a practitioner, whether you're a medical assistant or you're a PA or student or a doctor, how to deal with that. First of all, I would say get used to it. Mm-hmm. If you're going to be out in the world mixing it up with, especially with people who are ill, people who maybe are elderly, people who are in pain, people who are young who have a problem, doesn't matter who they are, when people come into the doctor, come into the hospital, they are not at their best. That's when people are feeling weak and vulnerable, and one of the ways that people deal with that is to be suspicious of others, those taking care of her, of them, and going on the attack. And if you're going to be taking care of people, you're going to make mistakes, and you're going to have weak moments, and your actions are going to be interpreted not as laudable motivations, but they're going to think the worst of you, and they're going to accuse you of the worst many times. So that happens. So get used to it. Be prepared to take a few arrows. Be prepared to have a little blood. Be prepared to feel bad sometimes about this, because it happens. And you'll have people even that will sue you in court, that will say bad things about you. That happens to all of us. And if it hasn't happened to you, you haven't been out there really practicing.
You haven't lived. You've lived.
I've lived, and now you're living, and that's part of it. So roll your shoulders back and, pull up your big pants and get used to it. That happens.